David, I think we're going to talk about weight loss drugs here.
Yeah, everybody's talking about it, right? So we might as well as well. Okay, Zach, thanks so much for being with us. First of all, talk about your company, Ro, and how much of your business right now is, can I use the word, consumed with these weight loss drugs, also diabetes drugs, I should say.
Well, I think, yeah, they're approved for both, but we'll talk about that. So yeah, I'll take a little bit of a step back. So Ro helps patients achieve their healthcare goals in the most effective and convenient way. We've done that over the last 6 years by vertically integrating a doctor's office, pharmacy, and labs, and we've helped millions of patients. We've been in obesity care for the last 3 years and have helped hundreds of thousands of patients start their obesity care journey and weight loss journey. And just over a year ago, we launched the Body program, and that is high-quality obesity care centered around GLP-1s. And one of the reasons why we're probably talking about it today is we have seen pretty unprecedented demand both to Ro.co, but across the whole country. And happy to talk about why, because we think that GLP-1s are satisfying very unique criteria, sort of never before seen in medicine, that's driving that perfect storm of unprecedented demand that you alluded to.
Well, let's talk about supply relative to demand, because of course Novo Nordisk and some of these other suppliers have really not been able to keep pace with the demand. They just can't make enough supply. What has that meant for your business?
Yeah, it's a great question. So we have seen supply challenges, right? In May of last year, of 2023, you saw Wegovy go on shortage. One of the first things that we did was we followed Novo's lead. We pulled back on advertising and shifted all of our focus to ensuring that our existing patient population could maintain access to treatment. And that included a wide variety of things. So that included adding additional drugs to the formulary, like Saxenda at the time, which is unfortunately now on shortage. It included calling tens of thousands of pharmacies, building up technology to seamlessly transfer prescriptions across the country when we were able to find supply. And most recently, it's meant adding Zepbound. So we added Zepbound at the end of 2023. And I think what's fascinating about the viewpoint that Ro has is we see patients across the country of all ages, all demographics, all incomes. And we actually haven't seen, which is very, very exciting, we haven't seen any challenges by our patients in accessing Zepbound since its launch. So we've seen unprecedented demand and unprecedented traffic driven to Ro.co, and we've seen really a spike in interest most recently in Zepbound. Part of that is most likely because of the news or TikTok and the Wegovy shortages. But from our perspective, we've just continued to add more and more products to the formulary to provide more patients options to make sure that they can get seamless access. And fortunately, right now, we're not seeing supply challenges on the Zepbound side, which provides a very a more effective, actually less expensive alternative for Wegovy.
So let's talk about that less expensive part. If I want and need a GLP-1, why do I go to Ro.com rather than just going to my doctor? I assume I have to get a prescription anyway, and then go to the local pharmacy. Are you cheaper?
Yeah. I think that's been, it's interesting that you asked that, because that's been a question since the day that we've started, and millions of people have chosen to do so. And I think the biggest reason is, how long does it take to go to your doctor, right? The average appointment takes 30 days, and people have to take time off work, and then they have to go to the pharmacy, and then they might have to go to a Quest, or they might have to go, drive 30 miles to do all of these different things and take a significant amount of time out of their day. And what we see patients value most is ease and efficacy. They want seamless access to the highest quality obesity care, and that is what we deliver. And so when patients come to Ro, when they go to Ro.co, they'll start and they can do it from the comfort of their own home. They can do it at 2 in the morning. They can do it on their couch at 6 p.m. While they're having dinner. They could do it on Sunday when they see a Ro ad during a football game. And they'll give us a comprehensive picture of their metabolic health. They'll do that through questions, images, videos, lab tests. And then again, a doctor will review that, have an interaction with them. We'll layer on insurance coverage. So I think that's a big value proposition that we offer that your in-person provider might not, where we've gotten really, really good at everything from benefits verification to prior authorization, have layered on everything from data analysis to make sure that we can maximize your coverage, maximize approval rates, and ensure that seamless continuous access. So it's a great question, but I would say that the two things that patients prioritize is that ease and that efficacy, and that's something that we've been able to provide for millions of patients across the country.
So convenience, efficiency, that sounds like that's your edge. I'm curious to hear what you think then about Eli Lilly's new direct-to-consumer platform. I believe it's called Lilly Direct.
Yeah, we think it's it's really amazing for the industry for several reasons. The first is that it's not just a pharma company implicitly, but rather explicitly endorsing telemedicine as a way to increase access to high quality obesity care. But one of the biggest, I would say, differences, whether that be a company, a pharmaceutical company that offers a directory of services, or some of these companies that are providing the option to employers or insurance companies, is incentive alignment, right? So Ro does not prefer one drug, right? We don't make the drug. We don't prefer one drug to another. We don't, contrary to maybe an insurance company's product or an employer's product, what we are prioritizing is what the patient wants and what the provider wants. And we're trying to relentlessly run after giving patients access to the most effective treatment for them at the lowest possible cost. And what you see right now is you're actually seeing companies, whether that be a pharma company, which is great, it's an endorsement of the industry, but you're seeing particularly companies that I would say are positioning themselves to be for employers here, where the things that they're advertising are twofold. The first is that they will intentionally put up roadblocks, right, making this medication harder and harder to access. Valid reasons, right? They're expensive, but not patient-centric. That is not something that Ro does. We are not intentionally trying to put up roadblocks to prevent patients from accessing this treatment. We're actually trying to do the exact opposite. We're trying to make it easier and easier for them to access a healthcare provider and access the treatment that is most effective and clinically appropriate for them. The second thing you're seeing a lot of companies do, which I think is a differentiator for Ro, is they're really talking about intentional and in mass discontinuation of the treatment. And right now, that might be a path for some patients. Again, obesity is such a heterogeneous disease that it deserves that personalized care, but there's not any evidence that recommends intentional discontinuation of the treatment for everyone. You do see the patients on average regain weight, but you also see them lose the cardiometabolic health benefits, the underlying benefits that are associated with the drug as well. And so the biggest difference, if you had to chalk it up, is that Ro's incentives are fully aligned with the patient and the provider, and we consistently run after making it easier to access the highest quality treatments. We don't prioritize one treatment, and we don't prioritize roadblocks.
Well, Zach, I want to really quickly ask you about your business. You were founded in 2017, $7 billion valuation at this point. Are you considering an IPO, raising more money? What does the future hold for Ro?
The future that holds this year is we are, again, I sound like a broken record, but we're just relentlessly running after helping as many patients get access to high quality obesity care, and that's our focus for 2024.
How much of your business at this point is represented by these new drugs?
So over the last 6 years, we've helped millions of patients, well over 2 million patients. And over the last 3 years, we've helped hundreds of thousands of patients start their obesity care journey.